Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, it's long been thought that being an optimist, having a positive attitude was a good thing, a good attribute for living. And let's face it, who would you rather be around? Someone who was positive, pleasant, happy like me, or someone who's negative and grumpy? And did you ever wonder, are people who are optimistic, people with a great attitude, are they less likely to get sick, less likely to die?
Well, a recent article published in JAMA, that's Journal of the American Medical Association, sought to find out if there might be an association or a link between optimism and the future risk for a heart attack or stroke, or even the risk of dying from anything. Does your attitude influence your health? Here to comment on optimism and cardiovascular health is Mayo Clinic internal medicine specialist, Dr. Richa Sood. Welcome to the program, Dr. Sood.
Thank you.
Nice to have you here. So, a very interesting study suggesting a link between optimism and heart health and even death.
Yes. So this was a meta-analysis, which means they pulled a bunch of studies from before, and that gave them the power. They had 230,000, about that number of people that they had in the study. They were interested in seeing if the association of optimism would lead to better cardiovascular outcomes, and that's what they found, that people had fewer heart attacks, fewer strokes, and less risk of dying from heart-related conditions if they were more optimistic. They also found that the risk of dying in general also went down when there was association with optimism. And what's more, there was a linear trend, which means that higher the person on a scale of optimism, less their risk of dying. So basically, people who expected a better future ended up having one.
Okay, hold on. So we need to change something at the beginning. I saw.
And I'm sorry, my name is Richa.
Oh, Richa. Okay.
Yeah.
All right. Once you adjust those so that they don't fall
they're
off.
falling off.
We'll redo the beginning at the end when we're done. Okay. So how did they do this study?
And how do you measure optimism?
Yes.
So meta-analysis is basically a statistical tool to pool a bunch of different studies together. The idea is that small studies have smaller power. So if you bring a bunch of those together, you have higher power to detect an association. And also sometimes the literature is confusing. Some studies are showing a positive relation while others are showing negative. When you bring everything together, you get a better sense of direction. So that's what a meta-analysis would do, and they did a meta-analysis. And their goal was to find out, is there an association with optimism to better cardiovascular outcomes and risk of dying? So many studies use different tools to measure optimism, but the most commonly used scale was called LOTS-R, which stands for Life Orientation Test Revised Scale.
So you're just asking the patients questions as they go along.
Exactly. So patients are asked to self-rate their optimism on this scale. Now, this scale has 6 items. And basically what they're asking is, there are statements there asking people, how would you feel about yourself, about others and life in general? Then there are questions about how would you feel about yourself, others and life when you're stressed? And maybe how would you feel about yourself, others and life when you're happy? So along that scale, every item was rated on a Likert scale, which is like 5 points from I strongly disagree to somewhat disagree to neutral to somewhat agree to strongly agree. And people would rate themselves along these items, and it's a continuum score. So higher rating along that scale is more optimism, and lower rating is pessimism.
So it's an optimism-pessimism scale.
It's a continuous scale for both.
Is there any way to explain this association between being optimistic and having better health outcomes, less risk of heart attack, less risk of stroke, less risk of dying from anything?
Other than perfect common sense. Is there any other way to explain it?
I think there's a lot of common sense explanation to begin with, and that sits on the behavioral aspect of things. So people who are optimistic are generally people who take charge. They're goal-focused. They educate themselves. They are the go-getters. So they would say, well, if I know that eating healthy and exercising and having a healthy body weight and not smoking, etc., is all going to be good for me, they would adopt those healthy lifestyles. That's part of how people believe the optimism works. But there's more. there is also a connection of optimism to physiologic mechanisms. So what happens is they've done associative studies looking at immune system and optimistic approach. So there are markers that are inflammatory markers like interleukin-6, C-reactive protein, and other markers of endothelial irritation. So optimists seem to have less of inflammatory markers. Now, on the other side, there is stronger association of pessimism and higher inflammatory markers. So that's very cool. Now,
sorry, go ahead.
there's a couple more things. So optimists also seem to have slower biological aging, if you may. So there are telomeres in our cells on the chromosomes. Now, the length of the telomere corresponds to the health of the cell. Longer the telomere, the longer the cell is going to divide for. It's a younger cell. We know that chronic stress shortens telomeres. The pessimistic approach shortens telomeres as well. So there is something to be said about our aging at the cellular level with negative mindset.
So we want long telomeres. So what's the clinical implication? I mean, obviously, optimism is important for health. Can you change someone's mindset? I mean, can you help individuals choose the way they think?
The short answer is yes. We have to give some credit to our genes first, because a lot of these attributes, whether it's optimism or resilience or other psychological traits, have some genetic attributes. Mostly we think it's 30 to 50% genetic. But then there's the other 50 to 70%, which is through learning. So we can do something about it. And there are some studies starting to happen looking into helping people reframe their thoughts, like CBT approach or through positive psychology, that can help reframe our thoughts. I think it goes back to the first thing, why would I even do it? So education, that it is not just a feel-good thing. It really matters at the level of our, living longer.
So if someone would say, well, I'm just a pessimist, my family, we were all pessimistic, and are you saying that we should look at being an optimist or being a pessimist as more of a habit than just a way that we are and we should accept?
So I think when we are something, we are asking ourselves, does that make me happy? Does that make me peaceful? Does that let me reach my goals? And if the answer is yes, yes, and yes, I don't think there's a reason to change. However, if the answers are not yes, then we have a reason to say, okay, something else seems to work better for success and for longevity. May I try that? Probably.
Is it, can we say that pessimism is a risk factor for heart disease?
The studies are associative. They're not causative. It's not something that they've done interventions on. So from what I gather from this article particularly, it is that we look at optimism and pessimism and we look at outcomes and correlate the two. So it seems like, yes, based on this associative data, it seems to be an independent risk factor. And that's a great question, because we have to think broadly. What causes heart attacks? The lifestyle of people not exercising, eating poorly, or having weight problems or smoking can cause heart attacks. So they adjusted for that. They looked at that specifically. Was that sneaking into the picture and causing the association to show up? That was not the case. So when they adjusted for things like, are these people... are they educated? Are they men or women? Are the studies done in Europe or US? All the factors that could influence outcomes they adjusted for, and the outcomes were still the same. One more thing, they adjusted for depression. What they're trying to say is optimism is not lack of depression. It is a positive mindset. It is on the opposite side. It's not just lack of something. Almost going back to the WHO definition of health, which is not the lack of disease. It is a positive well-being state. So optimism seems to be along the same spectrum.
If you had a patient and you gave them this survey and they turned out to be very pessimistic, would you suggest behavioral therapy?
I would be inclined to, for sure. With the strength of association, it's a third less risk of having heart attack and death from heart attack if someone is more optimistic. So
a third less risk.
35% reduction based on this meta-analysis.
And it also would make the patient feel like it would empower the patient.
Exactly. So it gives some tools for a person to work on, and it would help so many aspects of their life. If they're happy, like we started saying, I would like to have a happy friend. So they make more friends. And if they're a happy coworker, that's a happy environment at work as well. So it's not just physical and emotional benefit to self, it's more a societal and workplace benefit as well.
Behavioral therapy, do you have any happy drugs?
Happy drugs. There are many happy
Optimism
drugs there. That would be a great breakthrough.
Yeah, we'll work on that. All right, being an optimist does have an effect on your health. It reduces your risk for a heart attack by 1/3. It reduces your risk of stroke and death from any cause. Okay, I'm going to believe that only good will happen, but I'm always going to prepare for the worst. Our thanks to Mayo Clinic internal medicine specialist, Dr. Richa Sood.
Thank you.